So this is Miss Fuell. You met her in clinic, and she was cruising around helping us. Also, her daughter Janae is going to be filming. So she's an example who she's graduated from here, and then she's going down to Dixie, right? Well, you actually do it online to get her bachelor's, which I would encourage everyone to get a bachelor's if you don't already have it. So
don't wait as long as I do.
I really, yeah, I would really encourage you, and I'm going to talk about that in a minute. So anyway, I'm just going to turn the time over to her. She's going to go ahead and teach our lecture. They're going to film us, so you're going to be a star if she gets anybody but you. But smile at the camera. And anyway, so let's give her our full attention, and we'll do the other stuff later.
So I should probably click.
Yes.
Okay.
Oh, yeah, so do you want to get a drink? Go ahead. Drink?
Okay, so just to get started, I want to kind of just see where you guys are at right now as far as what do you have coming up? Do you have anesthesia boards coming up? That's on Friday.
Friday and Saturday.
Friday and Saturday. That's great.
We're not worried about this one.
Yeah, no, you guys got it. I saw when you guys were doing your shots in the clinic, and everybody looked really good. So, and I think you guys are probably ready for that. All right, what else? What else do you got coming up?
Up until April, when we have our annual board. We just boarded our last board last weekend, so we're a little
What board was that?
national.
Oh,
And process of care.
and process of care. And that's a new one. I didn't do that one. So I think it's really good though that they have you guys do that one. You don't think so? Well, I just kind of think that sometimes you go into to clinical practice, and it's good to just be reminded of what you need to do. So that's okay. Well, that's good. Okay, well, I'll introduce myself again. I kind of talked to you a little bit in clinic about me, but I wasn't a typical dental hygiene student. I was about 29 years old when I went to dental hygiene school, and I had 5 little children. My daughter Janae was my youngest, and she was about 18 months old when I came to. So it was not an easy time for me, but we suffered through it, and I was able to pass my clinical boards. And I was able to get my first job, so you guys will all be there, don't even worry. And it was, looking back on it, I don't know how I did it, so I don't recommend that to anyone. If anybody's thinking of anything like that, don't do it, so. Okay, we're gonna get started with the PowerPoint here. So when you guys took that test, was it foreign to you? I know you probably read through the chapter, but tell me what you know about some of that adjunctive testing in the chapter.
It's not used on a regular basis.
What was that again?
It's not used on a regular basis.
Okay, this is true. I'll be honest with you. I've practiced for 11 years. I've never used any of these adjunctive tests. Although I have sat in some CE credits and have learned quite a bit about it. And I feel confident that if the dentist ever wanted me to do it, I could do it. You know, it doesn't seem that hard to be able to take a little hemostat and put it into the pocket and put it in a little test tube and send it off. Pretty much, I don't think there's a lot of clinical, it's not going to be hard to do. So I don't think anybody should be afraid of doing that. Anything else sorry?
You pretty much only use them for like refractory, radio, or like implants and stuff.
Very good. So what is refractory? What is that? What is a refractory patient?
Return periods.
Okay, yeah. So once in a while, I notice in clinical, when I'm just working, I notice that somebody will come in, they have a lot of inflammation, and you start detecting calculus, probing, and you realize they don't have anything under the gum line. So then what? Is root planing gonna help this person? Yeah. Yeah, I mean, it's hard to say. There's nothing to take off. There's nothing to plane off of the roots. So, you know, sometimes you have to kind of use your brain and dig a little deeper. Okay, so I guess you guys have already went over periodontal maintenance. So what are the things that we use to identify the disease, periodontal disease?
Probe, radiographs.
Yeah. Right.
Cow.
So visual inspection, okay, probing, clinical attachment loss, and radiographs. So that's just a quick overview. That's what you do. One of the big things though that we need to do is medical history. Okay, so what kinds of things on medical history would you come across that would smoking? Was that diabetes? Good. Smoking. HIV. What else causes inflammation? I learned a lot about this at the dental convention.
Hormones. Latin.
Medication. I even learned this weekend that what we eat causes inflammation. A lot of processed foods, a lot of dyes and things in the foods can cause inflammation. Anything else? Stress. So I see a lot of inflammation during December. People come in and their drums are all red and bleeding, and I'm just like, oh, you're stressed out. So, okay. All right, so one of the first tests that we can do is called a gingival curvicular fluid assay test. Okay, and so what we're looking for here is the host response. So we have this inflammation going on, and it's due to the host response. You all understand what the host response is, right? Okay, good. So we have that. Wouldn't it be nice if we could identify that somebody's going to have periodontal disease even before they have it? Wouldn't that be nice? Okay, that's what these kind of tests are for. So there's certain enzymes and just neutrophils and things that are under the gum line, that if they are at elevated levels, then you would notice that they could get periodontal disease, develop it within this, 6 months or 3 months. This one in particular, if they have polymorphonuclear leukocytes and beta-glucuronidase and elastase, if they have those, then chances are they're going to develop periodontal disease within the next 6 months if those levels are elevated. All right. Any questions about that? Okay, it's pretty straightforward. Okay. Now this enzyme is a little different. If they have elevated levels of this, then what this enzyme, it's usually aspartate aminotransferase. It's usually in a living cell, but once the cell dies, then it goes extracellularly. And once that happens, elevated amounts of that would indicate that within 3 months, they'll probably have periodontal disease. So, question for you, just in regular clinical practice. So why do you suppose this isn't used that often? I think it is pricey. Yeah, and people lot of times they just opt out of it. So what can you do as a clinician? Right, educate them. What kinds of things can you say?
Research-based.
Uh-huh, yeah. Do you know what I tell my patients? And I don't know if this is super professional, but I just tell them, your insurance company doesn't care about your teeth. I care about your teeth. And I want you to care about your teeth. So that's usually what I say, and try to get them on board a little bit. Okay, so this is the culture technique, and what this is, what you have to do if you're going to culture subgingivally is you have to take everything off supragingival first. So you're going to want to go in maybe with an ultrasonic and rinse everything out really good, polish everything so that there's not a lot of plaque above the gum line. And then you're going to want to take a curette and dip down in, pull out some plaque, and smear it on a little glass thing. And just kind of smear it on there, send it to a lab, and then they can, they'll tell you what's on it. So what kind of a benefit is that going to be to you if you know what's underneath there? Perfect, yeah. Then we know exactly what bugs we can target. So with some of these labs, what they'll do is they'll send you back a total breakdown of what's under there and what antibiotics you can use, like a cocktail of whatever that you can use to go ahead and bust that out, get rid of it. So, okay. So a couple of things. This one isn't very well liked just because the bugs have to be alive for the lab to tell you exactly what to do with it. So lots of times en route, a lot of things will die. So this isn't one that a lot of hygienists like to use, but we just tell you what there is and then you can decide when you get into practice. Let's see. Okay, so then we also have microbial tests. These ones, there's two kinds that we'll talk about. One is the dark field microscopy, that's the one on top. And that one, oh, I'm sorry, I said that wrong. It's the phase contrast microscopy that's on top. And that one identifies how the cell moves. Okay, and then the one on the bottom is the dark field microscopy, and it tells you like the shape of the cell. So what do we know about spirochetes? What was that? They're bad? Is that what you said? That's right, they're bad. So, and that's how I remember things too. I love that. I like the simple way of just remembering it. So yeah, the little spirochetes, they're bad. They kind of burrow into the tissue and they wreak a lot of havoc. So when you see that, then you know that they've got some bad bugs down there. So some offices, which I think this would be kind of fun to do, is they'll actually take a culture sample and they'll put it on a slide, and then they will put it up on the screen and they'll show people what they have underneath their gum line, the little bugs that are swarming around. They'll say, no, these ones are bad ones. And so that way, that's another patient education thing that you can get people on board with that. We don't use that in my office, and I haven't seen that yet, but I think that would be fun. That would be fun to do. It's kind of fun to scare them. Okay. Okay, and then this one here is the nucleic acid probe analysis. And this seems to be the one that the hygienists like to use, simply because it's not as expensive and the bugs don't have to be alive when you're sending them off. So it's highly sensitive. It will differentiate between what bugs are there, and they'll also send you back a printout of what kind of antibiotics to use. So this is really good. Does anybody have any questions on that? No? Okay. Okay, and then this one here, this is the genetic assays. And so basically, I learned a little bit about this weekend too when I was at the dental convention. I thought it was interesting because they said that if you have a genetic predisposition to periodontal disease, then you're 7 times more likely to get it. And so suppose you have a patient that comes in and they have some other environmental factor or systemic factor such as diabetes and smoking, then what happens to that 7 times? Yeah, it's actually an exponential factor. If they happen to have 4 factors, then it's like they're 2,000 times likely to have periodontal disease. So what's something you can do as a clinician? Educate. But you know what? If you can help them eliminate one factor, you know, if you can get them to quit smoking, then that really kind of lowers their chance. You know, you can't get rid of a genetic factor. I mean, it's gonna be there. But if you can help them get rid of other things that's just gonna make it crazy, then that's where I would begin. 30% of the population have this. So that's 1/3 of anybody who walks into your office is gonna have this. So for me, I don't send this off to a lab, you know, to identify it. But what I'll do is I'll just talk to them. You know, they'll say, "Oh gosh, you know, I've always had bad gums, and I just don't know what to do. And I brush and floss all the time, and you know, and I'm looking, and yeah, they have pockets, but not a lot of debris, you know." And so the first thing I'll say to them is, "What was your parents' periodontal health like? Did they lose their teeth?" And then they'll say something like, "Well, yeah, my mom was in dentures by the time she was 30. Huge, huge factor. Make sure you put that in the chart because that's big. And I mean, you can't definitively diagnose because you can't do that unless you send it off to a lab and have them do a spit test or whatever. But you can put that in that it is a strong likelihood that they have a genetic factor. So I see a lot of patients like this in my office. You will too. Yeah. And it's frustrating.
If they do, I mean, what kind of OHE can you give them to work?
Well, what I tell my patients is you're going to have to work a lot harder than most people. You know, most people can brush and floss, and that's enough. But you're going to, you know, I would recommend that you be on a 3-month recall, you know, and we'll see if we can get some healing going on. But you and I are going to have to work a lot harder for you to be periodontally healthy than the normal person. And that's usually where I start. And then you start them on a good therapy and you watch them, see what happens. You see, a lot of what we do, I feel like, is trial and error. You know, let's try this. You know, and sometimes, you know, if they have a lot of inflammation and not a lot of calculus, what I'll do is I'll put them on a periostat, and I'll just say, let's try this, and we'll check you in 3 months. And I like to ask them, how does it feel? You know, do you feel like it's getting better? Because they notice, you know, and if they say, oh yeah, there's significantly less bleeding, then that might be a medication that they just need to be on.
So is the interleukin one more like because they have an overactive immune system? So when they get a little tiny bit of that, their body's like, whoa, we gotta get that.
Mm-hmm. Yeah, it's kind of like that. It's the response to the plaque. It's what the body will do.
So they have an exaggerated response.
And it gets exaggerated.
So that's what I was actually thinking too, is I was wondering, is it the inflammatory response?
Well, the
Or is it-
interleukin 1 has to do that being produced is part of the inflammatory response.
So that's my second question is then, so those people are probably also predisposed to like heart disease and stuff, because that has to do with inflammation of arteries, correct?
Oh, yeah.
So you would say these same patients are probably the same people who are falling into that category, just anything inflammation,
Mhm.
right? Okay.
Yeah, they've done so much studies on inflammation, and it's killing everyone. So you really have to, it's good if you can try to get that under control. And that's a great way to educate your patients, is by, leading it to their overall health. And I love doing that. So that's a great comment. Okay, so any other questions about the genetic basics test? Okay. I don't know what I did with my clicker. Oh, here it is. Okay, I just have one more slide, and this is kind of a silly one, but my kids love Bob Ross. Okay? And my daughter over here, Janae, she's a fantastic artist. And so she watches a lot of Bob Ross. But, with that being said, is as a dental hygienist, I think it's really important to be creative. Creative about the way that you give your OHI, but also be thinking, how can I make things better? How can I make things better for me, for my profession? Those people that, I can't tell you how many times I go to the dental convention, I walk through and I think, why didn't I think of that? I could be a millionaire. It's just awesome what people think of and can come up with. And so, it's okay to come up with a hypothesis, and test your hypothesis. Get your doctor on board and say, hey, let's try this, That's okay, within parameters, but it is okay. So anyway, we love Bob Ross. I was so sad when he died. So, okay, so with all of that being said, there's basically, I went over three main, oh, you know what? I'm sorry. I should have passed this out. Okay, I have an outline of this whole PowerPoint that I meant to give you, so I'm going to go ahead and pass this out. But, and then if you guys have any questions or anything, you can jot them down. Some people might be a little shy to raise their hand or whatever, but if you have any questions.